So the big issues that happened during the 1980s and the war on drugs and tough on crime era is that we focused on the wrong solution instead of intersecting public health and policing with the right investments in prevention, education, behavioral health resources, drug treatment resources. What we did is we just went in and mass arrested people, and we over-policed, in particular, certain communities. And those communities were poor, marginalized people of color.
Diane, welcome to Grow Healthy, Help People, the podcast that Accordis puts out. I love the title of our podcast, and it seems like a lot of what you're doing also. You're helping people in a specific part of life, a specific area of life. Where are you calling in from this morning?
I'm calling in from Las Vegas, Nevada, Sin City.
Love it. Law Enforcement Action Partnership. Tell me about what you guys do, and then I want to get into your story, because your story is not just this. You've been in law enforcement for your whole career, so tell me that story. But I want to hear about Law Enforcement Action Partnership. What is it you guys specifically do?
Sure. Law Enforcement Action Partnership started in 2002 when we had 4 retired American police officers and 1 active duty Canadian police officer that really felt that law enforcement needed a reset and a reboot, that we had been over policing people because the many failures of the drug war, and that had led to all sorts of unintended consequences, mass incarceration, over policing. And so
tell me what over policing is. I'm not familiar. Tell me what over policing is.
So over policing, like if you look at issues of law enforcement going into communities to make them drug free, right, is my policing career. It's kind of like this weird parallel was 1983 to 2004, and the emphasis was that if we invested enough time and money into the supply side, we would make America drug free. People forget that in the 1980s, Congress actually passed a law declaring that America was going to be drug free. And so we know that has been a complete failure because we're all drug users in many ways. It's what type of drugs are people using is, I think, I don't know about you, Shay, but I drink my cup of coffee and every morning 2 or 3 cups and require that caffeine, which is a drug. So the big issues that happened during the 1980s and the war on drugs and tough on crime era is that we focused on the wrong solution instead of intersecting public health and policing with the right investments in prevention, education, behavioral health resources, drug treatment resources. What we did is we just went in and mass arrested people, and we over-policed, in particular, certain communities. And those communities were poor, marginalized people of color who, in many aspects, because of socioeconomic issues, we were focusing the resources thinking that criminalizing public health and socioeconomic issues would solve crime. And it didn't. Mainly it didn't. And what we do know is thinking about how much money we've spent since Richard Nixon started the scheduling process for drugs and Schedule I drugs, is we have spent over $1 trillion in America. And if our drug policies worked, is drugs would not be illicit, unregulated drugs would not be readily available to all our children in all our communities, that the quality of them is that they are the purest that they've ever been, causing massive overdoses, and that the price wouldn't be as high. So we use policing thinking that it's going to solve an economic issue, and it never does. And it leads to, as an example, in California, it is now over $135,000 a year to incarcerate one person in our Department of Corrections. And so think about that as a living wage. Think about that as
What you could do with that. Yeah.
what could you do with that time and time and time again if we connected systems of care and recognize that we should leave the criminalization of people to people that really, really are harming people. We can hold people accountable, give them second chances, invest in systems of care that will continue to lead to a reduction in crime.
Wow. And so your history, tell us a little bit of your story. From California, you live in Las Vegas now, but tell us a little bit of your story, particularly related to law enforcement. And then I want to get into some stories of success that you saw then, probably because you arrested the same person hundreds of times over the course of your career, thinking this is not solving anything. Tell us a little bit of your story.
So I started policing in 1983 in Redondo Beach Police Department, Southern California. We had back then between like 95 and 110 officers. So we're considered like a mid-level police department. So there's over 18,000 law enforcement agencies, and most of them, which people don't understand, are 25 and under. So we're not an LAPD, but we're not a very small agency either. And so I retired in 2004. I was the second woman sergeant, the only woman lieutenant. Still, 22 years later, there still isn't any other women in positions of command. And I had a really, really interesting career. I fell into law enforcement because I was food and cocktail waitressing. I wanted to be an attorney. And the place where I ended up working at, lots of police officers came in who convinced me to go on a ride along. And I fell in love with policing because policing at its core really is about serving others. It's about being a member of your community. It's about giving back. And I'm not trying to defend bad policing, as Law Enforcement Action Partnership now exists, in particular to uplift great policing and to be able to be those subject matter experts who worked within the system to say we can do things better, and we have an obligation to our communities and to our country to build democracy and to engage with our communities in a way that is materially beneficial, that will create opportunities for community, not just safety, but for health. And so we tie in that appropriate government systems need to be all funded adequately, and we should all work with each other to get those benefits. And those benefits should be about the absence of crime. So I worked investigations, I worked a gang unit, I started a school resource officer program, I ran and managed our special investigations unit as a sergeant. So we had members of multiple agencies that were part of my surveillance team, and we did everything from dismantled meth labs to follow career criminals. And so, but I think for me is the best assignment still to this day was creating a school resource officer program. I still have kids that I maintain contact with who graduated from high school back in the 1990s. Is when I worked at the high school, I very effectively set up exactly those types of programs that we are now talking about. Is how do we help people, still hold people accountable, change people's lives for the better, reduce crime and disorder, and allow communities to thrive.
So, and you said 2002 or 2003, you and some others started Law Enforcement Action Partnership. Is that right?
2002, yes.
Yeah. So what prompted that? And then what is the organization doing now? Tell me more about what you guys do day to day.
So what prompted that was literally is the police officers that were visionaries recognized exactly what I talked about, which is the issues of how expensive the resources were in policing, and that if we invested them properly and saved policing for the people who are doing the most harm, that we could regain that trust that is required between law enforcement and the communities they serve. So there is a famous British police officer by the name of Sir Robert Peel that developed what's called the Peelian principles, and really the foundation of community policing. And his premise was that when you hire from law enforcement, people have to remember that the police are the community and the community is the police. And that voluntary compliance with laws is really what we're striving for. Is the social order contract is most of us don't go out and commit murders. Most of us don't go out and molest our children. Most of us, don't require that we need to be police. But what we've seen from the 1970s, 1980s, 1990s, and now we're reverting back, is to that tough on crime mentality, thinking that law enforcement is the only solution to public safety, and it's not.
So you see a shift kind of back in the wrong direction, is that right?
I do at this point. It's very interesting because let's take a look at the fentanyl issues right now. Is a lot of things that we're seeing very specifically across the South. I'm doing some work in out of Arkansas right now, where we can all agree in principle that fentanyl is bad in how it's occurred, but what we're trying to solve with really exceptionally tough criminal sanctions is to stop drugs from coming into the country, and that's just reactive. If that was in fact the case, the $1 trillion that we've invested in supply side enforcement, mainly going back to Richard Nixon, we would already be drug free. And so what we know is that strategic enforcement only works if you have robust systems of care that you can move low-level drug users into. So have you been overseas, over to Netherlands or Amsterdam at all?
I've not been there. I've been overseas a lot. Tell me more.
Yeah, so and really overseas in Western Europe in particular, but I'm just going to take Amsterdam as an example. I just came back from Amsterdam and was at a panel with a number of law enforcement representatives from the Netherlands National Police Department and Belgium. And the discussion was about America's drug laws. And there is a lack of understanding over there because in the Netherlands in particular, is low-level drug users are not pushed into the criminal justice system until it's a very, very last resort. So from a law enforcement perspective, they're spending 80 to 85% of their time targeting drug trafficking organizations, hardcore criminals that are causing the most damage in the country. Where in the United States, we're the complete opposite. We focus 80 to 85% of law enforcement time on low-level drug users who simply possess drugs, and then the remaining 15, 20% on drug trafficking organizations. So although there are less people in state prisons for possession of drugs, you are still seeing some extremely harsh sentences that really have no bearing on stopping drugs in the future or preventing people from starting drugs, period. And so there's this imbalance in enforcement strategies here that other countries just don't have. And so they also have robust healthcare systems. They have access to behavioral health. They have access to drug treatment. And then they save their criminal justice resources. So if someone who is using drugs hurts someone, steals from someone, they hold them accountable for that. But they also really, really work on treating the underlying system or symptoms of what is causing it. So as an example, Switzerland, not known for their crazy liberal policies, has had heroin-assisted treatment programs for years. And what they do is heroin-assisted treatment is reserved for people that aren't responding to methadone, and they've seen tremendous results where they would never go back. So if you are if you suffer from substance use disorder and you're addicted to heroin and methadone isn't working for you, you go to a clinic that's supervised for heroin-assisted treatment, and what they've seen is reductions in welfare, reductions in crime, people being reunited with their families. And so I think we have to look
and
at
a significant amount of cost savings.
And huge cost savings, right? So, is you're in Tennessee, so the two highest rates of, I don't want to say incarceration, but cost of incarcerating an individual are actually Massachusetts and California. Massachusetts, I think they're paying over $300,000 a year to house one person because they have less of a institutionalized population, right? And so again, we have to look at costs. What are the unintended costs of prohibition? And why, like, was it the famous Einstein quote? You continue to do the same thing over and over again. We're crazy this way in some aspects, that we think that declaring something illegal is going to stop people from engaging in that behavior. And, probably an interesting caveat on this issue is you could see this issue right now with the e-cigarette moral panic and the illicit vape issue going on in the country right now, where people want to the tobacco industry the exact same thing that they did to drug on wars, that they think that we're going to arrest our way out of people smoking. And so there's a lot of very, very interesting issues relative to drug strategies.
So tell me more about the Action Partnership, Law Enforcement Action Partnership. What are you guys working primarily with other law enforcement agencies, with policymakers? What is the big focus?
So we're a nonprofit, and we have, as kind of subject matter experts, Speakers Bureau, over 275 current, former, and retired criminal justice professionals. And these are folks that touch everything from, a local law enforcement to a federal law enforcement member, to judges, AUSAs, prosecutors, anyone that touches the criminal justice system on the prosecutor side. And all of our speakers, this includes active duty chiefs to retirees. So we say current, former, and retired. And what we do is we do everything from public education campaigns to legislative advocacy work with important partners, to the implementation of alternative responses to policing. So we have a community responder program that works hand in hand with law enforcement to reduce low-level calls for service that we shouldn't be sending armed cops to. Right? Why are we sending armed cops to a dog barking or to, a very low-level neighborhood dispute?
A car's parked here, we don't know what it's parked here for, that kind of thing.
Exactly. And so we have helped municipalities as diverse as Rochester, New York, to Dayton, Ohio, implement some type of community responder model depending on what the agency's needs are. So in Dayton, they developed a mediation team that is really showing some great things happening there, because we're starting to track that during the hours of service that the team is out, it allows their patrol officers to spend more time at their calls, more time with victims, more community engagement, more really trust building, which is what is required in order to reduce crime.
That's great. So are you running the organization day to day, or what does your team look like? I know you've got 100 and something volunteers or speakers, but what does the organization look like day to day?
I'm the executive director. We're a nonprofit. I have 16 staff Since I started, I've grown the organization small but responsibly. Nonprofits are nonprofits. We, have to go out there and beg for money. We don't take federal grants. We do RFPs. So I have we have the community responder program team. We have our media and communications team, a development team that really, makes the engine work. Is they're very, very good at what they do. And then we have our speaker legislative team that works with allies across the political spectrum. We're nonpartisan, so we work with everyone from CPAC to the ACLU and everyone in between, where all of us, there's a very, very interesting consensus in the world right now that from a bipartisan standpoint is we can all agree on a number of principles, and one of those is that criminal justice reform is not bad, and it actually benefits people in so many different ways.
Yeah, that's great. So as you're leading your nonprofit, if you're watching this podcast, Diane leads a nonprofit. She's got a great team. Some organizations don't have a team like Diane has. So if you need a back office team, accounting, marketing, database, that's what our company does. We talk to great leaders like Diane who have an organization they're running and leading. If you're leading an organization and need some back office support, let us know. At the end of this podcast, we'll put accordus.com, our website, also Diane's website, Law Enforcement Action Partnership, singular.org, and you can find more information there or make a donation there. Diane, if someone wanted to get involved in what you're doing, what's the best way for them to get involved?
They can reach out directly. There's an email, contact us on our website. Donations are greatly appreciated. We don't have very many volunteers because we don't do direct services, right? We are very policy focused, policy driven. We've testified in front of Congress, congressional hearings. We are very active across the country in smart on crime legislation with critical issues on everything from sentencing reform to drug policy reform, police accountability and transparency, to how do we uplift great policing and recognize that I think this continues to be an issue, that you can have great policing and still reduce the criminal justice system and still reduce crime. And we're seeing that right now across the country is really, really huge reductions, not just in homicides and in crime, but in the last couple years, there's been a 24% reduction in officer-involved shootings where people have died in fatal encounters. And no one really kind of knows why yet. And so there's some preliminary research going on. I think that a big part of it has been in the previous administration, there was significant funding to those systems of care. We funded heavily in violence interrupters. We were funding heavily into drug policy reform relative to the implementation of harm reduction, more access to behavioral health treatment, more access to voluntary drug treatment, more money invested in prevention and education. And from a policy perspective, it takes a solid 3 to 5 years plus before you really see meaningful results. And I think what I'm concerned about is that if we don't continue to invest in those right systems, you're actually potentially down the road going to see an uptick in crime again, or an uptick in the waste of fiscal resources. And you're a business person, and from the nonprofit space, I got to tell you, I really recommend that fractional. Being able to outsource is the business that you do is so important, because even at 16 staff, I still, look at, how do I use my money wisely? And I've done, I now finally have a full-time HR person because we need it, but we were doing fractional HR. We don't have a full-time bookkeeper. There is people don't understand the value of the infrastructure that companies like yours can provide, Shay.
Diane, thank you so much for your time today. Thanks for leading Law Enforcement Action Partnership. The work you guys are doing matters, and thanks for standing in the gap for those that don't have the opportunity to do so for themselves.
We appreciate it.
Have a great day.
Thank you.